Assalamu alaikum guys, this is Dr. Faiz Kharoti and today we are going to study the drug for heart failure. This is CVS pharmacology section and we are studying the drug for heart failure. So the drug today we are going to study is digoxin. Digoxin is the cardiac glycosides. Its oral bioavailability is 60 to 75%, half-life is 36 to 40 hours, that is very large half-life. Elimination is through renal as well as hepatic. The renal elimination is 60%, while that of the hepatic is 40%. Next, we are going to study the mechanism of action MOA of the digoxin. Digoxin inhibits the sodium-potassium ATPase. So now we are going to study the mechanism of action. So normally there is, let's suppose this hole is the myocytes, okay, heart muscle. Now there is the interstitium or extracellular. So actually the sodium-potassium ATPase, there is sodium efflux and potassium influx into the myocytes, but the digoxin inhibit this sodium potassium ATPase, so there is no efflux of sodium and no influx of the potassium. So if there is no efflux of the sodium, there will be sodium accumulation, number one, and number two, there are sodium calcium channel. So this digoxin after this blocking the sodium potassium ATPase, there will be no gradient for the sodium calcium channel that use the energy of the sodium potassium ATPase, means the sodium calcium channel use the ATP energy derived from the sodium potassium ATPase. In short, they are a secondary active process. This is secondary active process. Next, so if there is no efflux of the calcium, no efflux of the sodium, there will be intracellular accumulation of the sodium as well as calcium. So as you people know, when there will be high level of sodium as well as calcium, there will be high depolarization. So what will be the effect of this high concentration of calcium and sodium? Mechanical effect will be contractility due to the high level of calcium level directly proportional to contractility. There will be ejection, increase in the ejection fraction. There will be increase in cardiac output CO. There will be increased renal perfusion. These are the direct effect. Now, what are the indirects of the digoxin? So the indirect effect is on both parasympathetic and sympathetic. Actually, PANS means parasympathetic autonomic nervous system and sympathetic autonomic nervous system. So due to parasympathetic autonomic nervous system, there will be vagal stimulation and there will be decreased heart rate, HR. So due to sympathetic autonomic innervation and effect, there will be ionotropic effect that is due to the beta 1 activity. There will be increase in contractility. Ionotropic effect, beta 1 stimulation, contractility increases. So what will be the ECG changes of the patient, of the person when he or she is given the digoxin? There are two types of the ECG changes. Early changes are the late or toxic changes. So early changes will be PR interval. As you people know that PR interval means there will be decreased heart rate. So decreased heart rate, there will be PR interval. Also, increased PR interval. Increased PR interval means it means bradycardia. Decreased QT interval, ST suppression, and T wave inversion. These are the changes before the arrhythmias. Before the arrhythmias of the digoxin. The toxic responses or toxic doses includes PVC, premature ventricular contraction, and VF, ventricular fibrillation. So next is the effect on the digoxin on the conduction velocity. There are two types of the cell, muscle cell in the heart and nodal cell. Muscle cell, specifically you people know that parasympathetic autonomic nervous system has great effect on the atria only and negligible effect on the ventricles. So conduction velocity in muscle will be increased to increase contractility, and the conduction velocity for the nodal cell will be decreased, especially in the AV node. Next, what are the uses of the digoxin? Chronic heart failure. It is used for only the chronic cases also the atrial fibrillation. Next is what are the interaction, the drug-drug interaction between digoxin and other drugs. So first drug is quinidine, next is the verapamil. So these both should not be used with the digoxin, because I am going to just to clear the first quinidine. So quinidine decrease the clearance of digoxin, hence the level of plasma level of digoxin will be high, so digoxin toxicity can occur. Next, if digoxin toxicity can occur, what should we people do as a doctor, as a physician? So if the digoxin toxicity occur, this toxicity is worsened by the hypokalemia state, also by the thiazide diuretics and loop diuretics. So if a person is taking thiazide diuretics or loop diuretics, he or she must stop or consult a physician to use the digoxin. Next, the drug that has a worsen effect with digoxin is the effect that is hypercalcemia and hypomagnesemia. So hypokalemia, hypomagnesemia and hypercalcemia, these three effect worsen the digoxin toxicity, means that the toxicity of digoxin will be increased, also with the loop and thiazide diuretics. So the antidote of the digoxin toxicity is FAB antibodies, FAB antibodies. Also, you have to correct the level of potassium, correct the potassium level. Now, what are the side effects of the digoxin? Halose. What is halose? Halose is when there will be visual problem. How? There will be encircled color area surround every object. So for example, this is object, there will be colored surround encircled. You will see the circles surround any objects. Or hallucination, in short, you people will also notice vomiting, nausea and diarrhea. So there is a terminology, you people can pronounce it bigimni or bigimni. So I personally pronounce it bigimni. What is bigimni? When the PVC, preventricular contraction occur due to digoxin ratio, normal sinus rhythm, when this ratio on ECG become 1:1, this terminology, this phenomena and this condition is called bigimni. For example, this is normal sinus rhythm and this is PVC, premature ventricular contraction. Now this is next, again normal sinus rhythm, there is again a PVC. So 1:1, 1:1, this is called bigimni. So today we have studied the CVS pharmacology, drug for heart failure, digoxin, mechanism of action, mechanical effects, direct, indirect, ECG changes, and next we have done the uses, the conduction velocity effect, drug-drug interaction, toxicity, antidote, side effects, and the bigimni.